So as you're looking at that slide, let me tell you the reason why you need to know this, okay? National Registry, as well as a lot of EMS providers out in the field, were finding out that medics were coming out of training and they relied too much on their monitors. They couldn't, like what I was taught, how to diagnose a patient without using all this fancy equipment. Because we were in the ages where we didn't have a lot of this fancy equipment, or this fancy equipment would break down a lot. So we had to be able to find out what was going on with our patient. We couldn't just come to the ER and say, Doc, I don't know what's going on. My cardiac monitor broke, or my BGL broke, or whatever. My O2 sat was. We had to be able to have some type of impression of the patient, an assessment of the patient, what was going on. So the only way we could do that is by looking at the body and talking to the patient, okay? So that's why this is on here. You got to be able to distinguish between high and low sugar. Well, if you look at this chart here, which is out of your book, okay, out of the endocrine emergency book, okay, there's different ways to look at it, to tell the difference. But from a general, when you compare both sides, you notice that about 60% of these are pretty much the same. For example, like consciousness, irritable restlessness. To me, that's the same thing. Pulse rate, blood pressure, same on both sides, right? And some of these other things, I'm not going to be able, it's not common questions we ask our patients. For example, thirst and hunger. We might see the evidence of vomiting. I'm not big into smelling people's breath, especially during a COVID age. Okay? So, how are we going to be able to distinguish if our BGL machine is not working? One, because batteries are low, or hasn't been calibrated, or the test strips are been expired, or we ran out of lancets, we don't have anything to clean it with, the patient, or someone just forgot to restock it. How are we going to get a BGL on a patient? How are we going to know what's going on? All right. So the bottom here says, which of the following will give you a confirmation when you look at the patient or talk to the patient? Okay. When I look at this list, onset, sir or ma'am, when did it come on? Well, I've been kind of having these issues for a few days, versus, oh, it just came on within 10 minutes. There's a big difference, right? If it comes on fast, it's hypoglycemia. If it comes on slow, hyperglycemia. Skin too, because I can visually see that, right? If it looks pale, cool, and clammy, and there's no indication of shock, I might be thinking low sugar. Versus if it's warm, dry skin, maybe a little red, then it's hyperglycemia. All right? And then respirations is probably another one that I can just visually look at on the patient. I can tell when I'm doing my general impression how they're breathing. If they're breathing normal, but maybe a little shallow, then I'm probably thinking hyperglycemia. Versus deep and rapid respirations, which we call Kuznal respirations, now I'm thinking of high sugar. You see how that works? But you can't just take one. You have to at least collect three. Okay? So understanding how to tell the difference between a hyper and a hypoglycemic patient without having the BGL available, that's what your question is going to be asking you about. Okay? Now your question will ask you specifically, of these three, explain the difference between the two. But you're not going to know until you see the question. So I would advise you knowing both sides of these. All right? But here's a hint. What have you seen in the past on past exams? You can remember that, then you'll do fine on this question. All right? You good with this?